Hesqueps Tetsia. Good morning to all of the tribal members and the community members and everyone joining this town hall meeting today. We welcome you to this town hall meeting, and for those of you that don't know me, my name is Carol Evans and I'm the chairwoman of the Spokane Tribal Business Council. And we have all 5 council in attendance at this town hall, as well as the IHS representatives that will be conducting the town hall. To start off the meeting, we would like to start off in a good way, acknowledge our creator, and I ask Greg Abrahamson, our vice chair, to come forward to provide an invocation.
So you just stay right there, just do it right here, as long as you can hear it there, except that way over the crowd there. So cool. So lemons for this day, lemons for our people, for all the wonderful gifts you give us, Creator. Thank you for our health. Thank you for the people that provide that health. Thank you for the leadership that we have within our tribe there. Thank you for all the wonderful workers that we have that work hard every day and help to provide all the services that we need to maintain, whether it's our health or other parts of our living. Thank you for our children. Thank you for our elders. And Creator, as we go through this, let it be a good dialogue, that people get good interaction, let us get good direction that's needed and things that we may need help on finding out how we can do a better job. Because the jobs that we're doing is very exceptional, that are people that come out every day from different areas there, and you watch over them and their travels and keep them safe. And Creator, as we are a big family, so keep our family safe, and as we deal with this virus there, until we get a vaccine for it, keep our people safe and not let us lose anybody there as across the country or across the whole world there, that a lot of lives have been lost to this virus there. We hope that we don't lose anybody and keep our people safe. And so when we move forward and go on with what we have to do there to provide the proper health care and proper services that we need there, and just keep everybody in a good, healthy mood there and stuff there. In your name, amen.
Thank you, Greg, for that beautiful invocation. And also the other tribal council in attendance is Glenn Ford, Danny Kiefer, and Tiger Pion. From the clinic, we have Jeremy, the CEO, Marge, the doctor, and then Alicia, a new employee with the Indian Health Service. Like Greg said, this virus is a serious thing. It's caused a pandemic, and we've lost a lot of lives in the United States as a result of this virus. And it doesn't discriminate. It affects everybody. And we know without a vaccination that all are at risk, especially the vulnerable. So we take this serious, and we must always remember that there are ways that we can control the impact of this pandemic of this virus by observing the rules, the regulations, or the advice set in place. We all know that wearing a mask is essential to limiting the spread of this virus. So tribal council, the clinic, we encourage that and require while working that everyone wear their masks. We ask that you social distance and that you exercise the proper sanitation methods that are advised by the CDC, the tribe, and the clinic through policies and that are developed, and of course we adopt them by resolution. So we hope that you have a good town hall today and that a lot of important information is passed on so that the public is properly informed and that you know what you need to do in case you have questions. So with that said, I would like to go ahead and turn over the meeting to Jeremy, the CEO from the Indian Health Service, our local clinic. Jeremy.
Thank you, ma'am. Thank you, Carol. Thank you, Tribal Business Council, first for hosting us and allowing us to come over to the beautiful chambers and use your space. For those who don't know me, my name is Jeremy Howell. I'm the Chief Executive Officer for the David C. Wynkoop Memorial Clinic, which is your clinic. And over to my right is Marge Kepping. She is our clinical director, so she's here to provide me some support in that world. And then, of course, Alicia Edwards, you don't see her, but she's a new health system specialist for the clinic. And she's learning what it's like to work in an Indian Health Service clinic. So again, thank you for having us. I just want to start off by saying first, thank you for all that everybody's doing. As I've been out in the community, I've noticed an increased use of mask wearing, social distancing, and that helps. I can say unequivocally that our numbers have been, knock on wood, have been much better than most. And I would like to attribute that to the community and adhering to guidance and policies and procedures and to regulations that are put out. So thank you. It makes our job easier, and also it ensures a healthy and safe community and working environment. To start off, I want to, again, just bring up a few things. First is a campaign that we're doing as we still kind of move forward. School still might happen. You know, some school systems are, kids can show up and do a hybrid. Some kids are all virtual, but that doesn't mean our kids don't need immunizations and physicals. Those are still very, very important. So every Tuesday and Wednesday, I believe, from 8 to 9 a.m., we are doing a hybrid physical and dental exam for our children in the community. And we're doing it in the mornings because we're hoping to keep our well visits. So those folks that aren't experiencing any signs or symptoms that we might be able to attribute to COVID-19. So please give us a call at the clinic and we'll push that number out. To schedule an appointment if your child might need a physical, a dental exam, and also catch up on immunizations. And that rolls into us as adults. We as adults also need immunizations. We have the fall coming up. So flu coupled with COVID. We don't know what the fall might look like, but we can project. As we get our flu vaccine, we'll be pushing out an influenza vaccine campaign. And also some of the other immunizations that you might need. Could be tetanus, could be Hep A, Hep B. Please give us a call and we can check to see what you might need, and we can get you in to ensure we are engaging in that preventive care that we still need to do in spite of the pandemic. With that, the last thing, well elders as well are Monday, Tuesday, Wednesday, and Friday in the morning from 8:30 to 11. And again, that's just to provide those folks in our community that might be the most susceptible to COVID-19 to have a safer environment in the clinic. So with that, I'm going to turn it over to Marge. She has a few things to discuss regarding some of the process and procedures on the clinical side of the house, along with some prevention and other things that we're doing at the clinic for you. Thank you. Marge.
Thank you, Jeremy. I wanted to start first with kind of giving people a little bit of an overview about the current state of COVID-19 in the Eastern Washington area as it affects us here on the reservation. The Northeast Tri-County Health District is our local health jurisdiction and encompasses Lincoln, Ferry, and Stevens County. And just on their website, they noted among those three counties 188 cases so far, which is a rather large increase over the last several weeks. We know that in Stevens County, there are a few places that seem to be hotspots, one being kind of the Colville, Kettle Falls area, which, you know, has a little bit larger population there. So we kind of expect that. Loon Lake, the 9 Mile area, and then, you know, Wellpinit, we've seen a few more cases in the last couple weeks. In the rest of the Eastern Washington area, Okanagan County is really kind of standing out as a major hotspot for new cases. The county population is somewhere around 42,000 and they have over 900 confirmed cases. The town of Brewster in particular has a very high COVID right now. So there are some spots in Eastern Washington that we are very concerned about. We're also hearing other reservation areas, Yakima for certain, but also in Chilean, the Usk, Nespelem, Omak, Lapwai, Warm Springs, Fort Hall, Coeur d'Alene have all been experiencing some increase in cases lately. So very important that if you're traveling to any of those areas, that you be aware of that and maintain social distancing where you can. Wear masks when you're out and about, and don't forget the hand washing and hand sanitizing piece, probably every bit as important as the others. So just wanted to kind of paint that local picture for you. Back at the clinic, we are, of course, doing testing in our little tent. We hope soon to have a little bit more permanent building that will be able to see us through the winter and allow us some a better little working environment there. The testing in the tent we're trying to do by appointment. One of the things we've learned here is that our cases and our demand for testing kind of goes in little waves. Whenever we have some positive cases, we have a lot more people we need to get through that tent. So we have moved to doing testing by appointment. And so we encourage anyone who thinks that they've had an exposure or that they're having symptoms that might be COVID to call the clinic and speak with our contact tracers. Our contact tracers are Tressa Martinez and Liz Saxey, our public health nurse. And that allows us to get some information ahead of time and get an idea of maybe how widespread the exposure is, and then be able to fit those people into our testing schedule so that we can get you all in. Especially with the weather being very hot in the past week or two, we've had days where we've had to really close the tent for testing at noon just because of the heat that's out there. So we really encourage people to do that calling ahead of time and getting an appointment slot so that we can keep people moving through and not having to sit there in their hot cars for us. When you arrive at the testing tent, a provider or a nurse will come greet you and get a whole bunch of information from you about your exposures or about your symptoms. They will collect vital signs from you, check your oxygen level, check your temperature, and then collect that swab from you. We have two ways of doing testing at the clinic. We can do a rapid test, which takes 15 minutes to run. So that doesn't mean that if you show up at the tent, you're only going to wait 15 minutes. If we have a backup of testing, we can only run one test at a time. So there are times where you may have to wait for that result. There may be other not so busy times where we can get that result to you in 15 minutes. The other way we have of testing is to send that nasal swab out to our reference lab. And you've probably been hearing about the delays that are involved with that. Sometimes there have been delays up to 10 days or longer to get that result back. So the reference labs have started doing priority testing, where when we take a swab from someone and send it in, we can put a priority on it. So if that person is having severe symptoms, they're a high-risk person, that gets a higher priority than someone not having symptoms or that like. And so the very top priority goes to those people who are hospitalized, who are waiting, for that answer. So by doing that prioritization, they've been able to get that wait time down quite a bit, and we're seeing results coming back much more quickly now. So just that's what you might encounter when you come in for testing. So those two tests are very different, the rapid test and the test that we send out to the reference lab. The rapid test, of course, the value of it is that we get an answer right away, and that allows us to, if it's positive, to be able to secure other people that might be needing testing or might have been exposed. The send out test takes much longer, but is a much more accurate test. We see fewer false negatives. with the one that we send out to the lab. So sometimes when people come in for testing, they may get one test versus the other based on symptoms or their exposure or what's going on with that person. We also are having a lot of people who are getting scheduled for surgeries and things of that nature where the surgeon wants them tested before their surgery. And those, again, are things that we really want you to call the clinic about before you come in, because we need to find out from that surgeon which of those two tests they're wanting or will accept. And so that helps us have a little wiggle time there to get a hold of that office. And then when you come in for testing, kind of the final thing is after we make a determination about whether you need to isolate or quarantine, we provide you with a work slip that tells your employer that you've been, screened on this date, and any recommendations about, are you good to return to work? Are you needing to, be in quarantine till a certain date? We don't use testing, a negative test, to return somebody to work. The reasons for that are because quite often people will test positive long after their infective phase has ended. And so that's just the body trying to clear the broken up particles of the virus. It doesn't mean they can infect other people, but they will continue to test positive for a while. So it's difficult to do testing in order to return people back. So we rely on isolating and quarantine, and people will often hear those two words, and there may be a lot of confusion about what is the difference between isolating and quarantining. And to those of us, in the medical field, there's a big difference there. So isolating people, or asking someone to self-isolate, is done so that we separate someone who's sick with a contagious disease from other people who aren't sick. So within a household, if one person is sick, we don't want the other people to get sick. So we ask them to kind of, be in a room away from the others and try to self-isolate. Quarantine, on the other hand, is an attempt to separate and restrict the movement of people who were exposed to a contagious disease to see if they become sick. We know with COVID-19 now that the incubation period, that time frame between when you were exposed and when you can become sick, is anywhere from 2 to 14 days. So 14 days is often the outside of the quarantine period that you'll hear people talk about, or that someone may recommend. So if you've been exposed to someone who's positive, we want you to be in quarantine for 14 days, because we're looking to see, are you going to become sick? And we want to make sure that by doing that, we're not exposing other people in the community. So isolation is when someone's sick and we want them to be separate from people who aren't yet sick. Quarantine is when you've been exposed to someone who's sick, and we want to make sure that we limit that exposure and don't make the circle bigger. So this is where our contact tracers at the clinic are really making a great difference, because they can intervene, we can quarantine, and we can use that as a tool to stop the virus from spreading. I think we've done a very good job here on this reservation with doing that. And we're seeing that in our low numbers so far. Just a few words about prevention. We've talked about all those good things of social distancing and wearing masks and hand sanitizing, and it's easy to kind of feel like your movement's restricted or you can't go places and do things. And it's important to know that it's summer and there's activities out there to do, and there's things that you can do. Social distancing and wearing a mask doesn't mean you can't go out camping and, enjoy the river or go fishing or bike riding with your friends. And some of those activities are actually pretty low risk, because it's hard to do them without being 6 feet apart. So bicycle riding is a great example of that. It's kind of hard to be closer than 6 feet when you're doing that. So there are some activities like that that are really, pretty low risk. But again, in those instances where you can't maintain that 6 foot social distance, wearing the mask and doing frequent hand washing and hand sanitizing is a really good prevention. We want to mention also that having a negative test does not mean you don't have to social distance or wear the mask. That negative test is kind of a point in time now. It doesn't mean that you're less susceptible to getting COVID if you become exposed. So we really want people to do that. It's important to know, I think, because people have had a lot of questions about it, the difference between the nasal swab testing that we do at the clinic and antibody testing, which is a blood serum test that can be done to look for antibodies. Those two tests are really, really different, and they're looking for different things. The swab testing that we're doing at the clinic is to actually look to see if the virus is present. So that test is designed to look for certain proteins on the capsule of the virus, or to replicate the RNA of the virus to see does that person have the virus. Antibody testing, on the other hand, is looking at your immune system's response. So those antibodies are created in response to a virus. And so the antibody test can tell us if you've been exposed in the past to a virus or a similar virus. So it can give us information in a big population about how many people may have, had that disease already. It can sometimes give us an idea if we're anywhere close to what's called herd immunity, where enough people have had it that it's not as big of a threat. So it has some usefulness there. But that antibody test can't tell you if you actually have the virus. So it's really important that if you're having symptoms, if you're sick, to come to the clinic and get that nasal swab. That's what tells us if you actually have the virus and are capable of spreading it to somebody else. And so we want to make sure that people kind of understand the difference of those things. We know a little bit more about the virus now to know that when you are sick with COVID-19, it takes you several weeks to develop antibodies to that virus. So you can be sick with COVID, be able to give it to somebody else, but your antibody tests may show negative because your body hasn't had time to create the antibodies yet. So you have to be very careful about understanding what those results mean and know when you should, actually get a nasal swab test and find out if you have the virus. So we welcome, again, any questions with that. And our contact tracers are always available there at the clinic if people want to call, or if people are concerned that they've been exposed, or they're not sure if their symptoms might be symptoms of COVID. Those are all important questions to ask, and we're there to help and provide information for that. Is there any?
And I know that I think the tribe is offering antibody testing, and so we are getting some calls at the clinic. So just for the community, we can't pull up those results, and nor can we decipher those results. So if you do have a question, I'll probably divert you back to the laboratory to where you had that test drawn. We just don't have the ability to pull that up or to be able to provide results for those labs. I do want to say, we're here for you. That's why we come to work every day. If there is a question, a concern, or a challenge, please bring it to our attention. If we don't know about it, there's nothing we can do about it. Teresa Martinez is our patient advocate as well. So she's kind of our first line of defense for that. And my door is always open to any patient, anybody that is seen in that clinic can always call or stop by and see me if there's a concern, challenge, or whatnot. And again, thank you for, just for everybody listening to the guidance. And I'll say, Marge practices medicine. All providers practice medicine. And so as you're on social media, you may see and hear things as guidance changes, and that might mean that it might not be as severe as we put it off to be, but guidance does change and things do change in medicine as we learn more and more about the virus. And so just kind of keep that in the back of your mind. As we learn more, we'll share more information. We, on our Facebook page, we are constantly sharing CDC information and other information that's going to be valuable to the community so you can better protect yourself every day. And again, thank you. Any questions, please don't hesitate to reach out to us. And again, Tressa is our patient advocate, and she is doing a fantastic job of helping folks who might need help. It looks like we do have a few questions. Is the clinic participating in the clinical trials that are going on presently? No, we are not, that I'm aware of, and I don't believe we will be doing that in any time soon either. How reliable is the mouth swab test? Marge, I will.
I'm wondering if someone's asking about the new saliva test that's coming out. You know, honestly, we really don't know a lot about reliability of that test until we actually see it in use among people and start to get a sense of how sensitive or specific that might be. When we talk about a lab test in medicine, we are talking about two things. One is specificity, which is, does that lab test reliably tell us that this is COVID-19, or, you know, as distinguishing it from some other virus. So there's specificity that we look at. There's also something called sensitivity, which is how well does that test actually pick up someone who's got the virus. And so oftentimes those are things that we don't know right away. A lot of these tests, including the new saliva test that I think is coming out, have been released under an emergency authorization order from the president because of the pandemic and the urgent need to get things under control. So when they are released under that kind of authorization, they sometimes forego a lot of that testing until we get it out there, we see it in action, see it in work, and are able to then say, oh, that test is very specific but not sensitive. Oh, that test is very sensitive, but it may not be specific. So I think the word is still out a little bit on the saliva test. We'll have to see how that performs in practice. The value that I'm reading about that is that it may be a test that people are able to do in their home. It may develop into that kind of thing, which would be very useful. And certainly it's much nicer to get swabbed in your mouth than it is up your nose. So we really hope that that turns out to be something that we can use to do that.
And to tag onto that, we do have one analyzer. We have had one on order for a while, but nationwide there is a back order. And they've been back ordered for several months. So once the analyzer comes in, that will allow us to increase our capacity quite a bit. And then obviously we'll probably change operations as once that comes in and we get it all tested and ready for lab use. And as Marge mentioned, we are working to get an office outside up in our upper level parking lot by our warehouse, so patients can truly just drive through. That's just taking some time to get that up and get the electrical stuff needed for that, but that's in, and we're hoping to have that soon, well before winter time. So,
which kind of answers this next question about what is IHS doing to prepare for the fall when we're thinking that COVID may surge. And so a couple of things that we're doing. One, Jeremy just mentioned the more permanent structure in our upper parking lot that will allow us to do testing and to actually even see patients who are sick outside of the clinic in order to help us keep our well patients separate from our sick patients. So that's one effort that we're really making right now, is to, in time, we want to see our well patients in the morning hours and try to get our patients who are having symptoms or sickness to come in the afternoon. So we separate people by time. And then within the clinic, we have a fire door that separates one part of our exam rooms from the other part of our exam rooms. So we try to keep the well and the sick separate, even inside the clinic. And we're working on refining those plans for the fall when we think we may have more sick people arriving. The other thing that we're doing in preparation for the fall is planning for a really expanded flu vaccine campaign, because you can imagine that having the flu and COVID-19 going around at the same time is really not a good scenario. Makes it difficult because the symptoms of the two overlap, and it's difficult to be able to separate those. So we're going to be pushing out a big campaign to try to get as many people as we can vaccinated for the flu. We know a lot about the flu because we've been doing that for a very long time. And we know if we can get that immunization rate up to about 60, 70% in our population, we get what's called herd immunity, where we don't get big outbreaks in the community of flu, and we have a much better, lighter flu year. So we're really working at that. We are also very concerned about the drop in childhood immunizations that we've been seeing since COVID-19 arrived, and people were more concerned about coming into the clinic or being around other people. And so we're trying to do a big effort of getting kids in for Well Child, for their school physicals, for all of those things in order to get them that same update of their immunizations. We don't want to see a measles outbreak in the middle of COVID-19. So those are some of the things that we're doing to really ramp that up. We've also done some looking ahead in terms of our supplies and our equipment, and trying to focus on getting those things kind of in stock so that we are prepared for that as well.
And sometimes we forget about ourselves at the clinic, our providers, our nursing staff, they work really hard. So Marge and I are also in discussions to figure out when to appropriately bolster our nursing staff and our provider staff. So the area office does have intermittent providers that can augment us if things do pick up beyond our workload. But right now we're doing fantastic, but we are also looking at our staffing to make sure that our staff just doesn't get burnt out as well. So we're taking a look at everything, and that's been ongoing for the past few months. And that's part of our strategy for the fall and winter.
Yep.
Is there anything else? All right, I think Carol, Glenn, did either of you two have any questions for us?
So what about the blood testing? The test for the COVID blood?
So we talked a little bit, the blood testing that you hear for COVID is again looking for antibodies, not the virus itself. So we know the best way to find the virus is actually in the respiratory secretions. And so that's why we have nasal swabs and now maybe oral swabs and saliva testing. So that's the most reliable way to actually find the virus and diagnose someone with COVID. The antibody test, which is the blood test, is looking only for the immune system response to COVID, which could have happened 6 months ago, or it could have happened 3 weeks ago. We don't know. It doesn't tell us anything about that, and it doesn't tell us if you have the virus right now. You need the swab to do that.
So clinically, there's no utility for us on the clinic side for the antibody testing. It's a good question, though.
Yeah.
So my question would be, in the last pick that we had, or the last group that we had, it seems like it really more than doubled our numbers. And so to help people be at ease, because sometimes in those times, everyone wants to get a test, so they're all kind of going on the clinic and wanting that test right away. So what's your recommendations to the community regarding that? And how can we put people at ease knowing that they'll be put in somehow they'll be tested based on some type of process that assesses who should be tested first or how that should be handled?
Mhm. So that's a really good question. And the first thing that we like to do at the clinic is, or just in the community, is encouraging people to wear this mask. This mask reduces your chance of either giving it to someone or getting it yourself by about 75%. That's one of our best defenses. If you think that you've been exposed in some way, the most important thing to do is to self-isolate at home and then call the clinic so that we can talk with you about your symptoms and about any exposure that you might have had. So if you were, at a large gathering and people weren't wearing masks and you heard later that somebody was positive, call the clinic and talk to one of the contact tracers, because they are often really ahead of the game in knowing where our positives have been and where we're seeing people come up positive, and they can help both reassure you, that we really haven't heard of anything happening in that area. Or they can say, you know what, it sounds like you might have been exposed. Let's schedule you for a test and get you in. I'm not aware of anybody that we've had to turn away, but we've sometimes had to space people out over several days. With our single Abbott testing machine, because it takes 15 minutes to run a test and you can only run one at a time, that's a limit of about 25 tests total that we can do in a day if we're using the rapid machine. So that kind of limits a little bit with that. But oftentimes, if you've been exposed to somebody, you have to remember that incubation period is 2 to 14 days. So if you get tested on the same day you were exposed, that might be a little too early to even pick up an illness. And again, the contact tracers can help talk you through that and figure out when the best timing would be to check you and to get you tested. That's not always the same day you think you were exposed. So again, calling them and talking that through with them really gives us a better way to time that out. And the important thing, again, is if you're sick, if you're showing symptoms, stay at home. Self-isolate until we can do that testing and get you screened.
And just to tag on, if a nurse or a provider, the contact tracer suggests that because anything we provide is going to be a suggestion. It's guidance. We're not an authority figure in that sense. But if you are requested to quarantine or isolate, you really should quarantine or isolate, and you shouldn't be out doing other things, because what you're doing is you're just potentially exposing a loved one or someone else in the community. So again, just to reiterate, if it's suggested that you quarantine or self-isolate, please do that for the prescribed time frame. That's vital. Glenn, did you have anything else, sir? Danny? All right, so if that's all, Marge, Alicia, thank you for your support today, and thank you again, Tribal Business Council, for hosting us, and thank you to the community. And again, if there's anything you need, please don't hesitate to call us at the clinic, and we'll do what we can to take care of you. Thank you.
Thank you.